All right, so here's all the systems for the head to toe. We have the cranial nerves, we have the chest and lungs, we have the heart and vascular, we have the abdomen, we have the female reproductive, we have the musculoskeletal, we have the breasts, and we have the male reproductive genitourinary. So I'm gonna scramble them. Okay.
Okay, fan them all out. And I got breast and male GU. Toss those.
All right.
Okay, so male, they're going to empty their bladder, and they can be in two different positions. They can either be laying supine with their legs kind of apart, or they can be at nobody's favorite eye level. You're going to want to put on gloves because you don't want to touch anything. You're going to have them do a little crunch. So you're looking for any hernias, especially inguinal hernias. So first thing you're going to do is inspect, and you're just going to want to inspect for hair distribution, skin condition, if there's any obvious lesions. If they have the presence or absence of a foreskin, um, the position of the urethral meatus, if they have like any obvious discharge, you can take a culture at that time and send that off. Um, so then you're going to look at the scrotum, and again you're going to look for skin condition, hair distribution and condition, any obvious lesions. You're going to look for size, shape, symmetry of the scrotum, if there's like any swelling or anything. Then with your gloved hands, you're going to palpate the penis. If you need to retract the foreskin and look at the glands of the penis, you can. You're going to, when you palpate the penis, you're looking for like any nodules, any tenderness, if there's any masses or anything in the penis. For the scrotum, again with gloved hands, you're going to palpate the scrotum. You're looking for size, shape, symmetry, any nodules, any tenderness. You're going to palpate the gonads and the epididymis. You're also going to palpate their inguinal lymph nodes. So that would be down the inguinal chain into the inner aspects of the thigh. Because it's urinary, they should be producing 30 to 50 mLs of clear yellow urine per hour. What else did I get? Breast? Mm-hmm. Yeah, I think I got breast. Okay, so breast. You're going to, before you lay the patient supine, your patient's going to be disrobed from the top. Male genital urinary, you only want to have their business uncovered. For the breast, you only want to have the woman uncovered from the top up. You're going to compare her breast bilaterally through the exam. You're looking for size, shape, symmetry, skin condition, any lesions that she has going on. And then the arm positions, so she can, while she's when you're inspecting her arms are going to be at her side and then out, but not over her head. She is going to place her hands on her hips and press in, and then when she's sitting, she leans forward so that you can look for any dimpling or anything. And then the nipples, you're going to look for any obvious discharge, If there's obvious discharge, then you can culture that and send it out. Um, so then you're going to be doing the exam. So with gloved hands again, you can do the vertical up and down motions. So you're going to start at the sternal border and you're going to do up and down motions throughout the whole breast. Then there is the circular motion. So you're going to start at 12 o'clock on the top of the breast and work your way clockwise around the breast in ever smaller circles until you get to the nipple, or you can do the pie wedge. So you're going um, in pie wedges, either out from the nipple or in towards the nipple. You're just looking for any obvious lumps that she might have there. For the nipples, you're going to check for elasticity, if she has any tenderness or anything. Again, if there's any discharge when you palpate the nipples, you can send that off to the lab. When you are doing her breast exam, you also want to make sure that you palpate into her axillary for the lymph nodes and into her cervical lymph nodes. And you're also going to want to check for any hair distribution and condition that she has in her axillary. And that's it.